Hey everybody, it's Elisa. I'm back. I'm talking about the respiratory system. Now we're going to look at spirometrics or spirometrics, both are correct. And so what this is looking at measuring the volumes of air that are being inhaled and exhaled in the lungs, right? So lung capacity stuff. So here's how it's done. So spirometry is the measurement of pulmonary ventilation, the amount of air that you're inhaling and exhaling. That's what we're looking at. And we're going to use a special device, and guess what it's called? Spirometer. Okay. So, let me see if I can just show you the picture. Here's like a one of many different kinds, right? So basically, you're going to blow in and you're going to push out, right? And it's going to measure like the volume, like how much you're blowing in and blowing out, right? So that's it. And they don't all look like that. Like so they're very, very simple, actually. Um, They do a few things like they can allow to measure within a couple of variables. Like you want to time it, you want to count the amount of breaths. It allows you to determine the depth of breathing. So if you're timing it, the rate also as well. So that can also help you understand a little bit more about the rate of gas exchanges also in the body. There's some things you need to know about, right? Some keywords. Here's your flashcard, right? Like here's one of them, tidal volume. So that's the amount of air that's like, think of like a tide going in and out of the ocean, right? Like going in and out. So it's the amount of air inhaled and exhaled in one cycle of breathing, like the of it, right? It's just the tide of air that's moving in and out. Okay, so as we talked about a little earlier with especially the alveoli, like the thing is you can never, here's alveoli, right? Like here's the idea of here's alveoli, here's like little bronchial going in here. Okay, you need to always have like some amount of air in there because it holds the shape, right? Because if you were to actually get all of the air out, it would like just flatten, right? Like all of these would flatten on themselves and you could never breathe in ever again, right? That would be collapsed lung, right? So you need to have these reserve volumes, okay? And so this is the air in excess of the tidal volume. So this is like the air that's like left over in the lungs after you've been breathing in and out, okay? And it's keeping the shape of the lungs, right? And so there's the inspiratory reserve volume. So that can be inhaled with maximum effort, and then there's the expiratory, right? So that's going to be the air excess of the tidal volume that can be exhaled with maximum effort. Okay, so that's what that means. Oh, there he is doing it, right? I'm guessing that's the spirometer. And like, but some of them are really tiny. It's like literally like a pressure gauge, right? And like here's a little pressure gauge and here's all the numbers. And then, here's like the box and then there's a tiny little tube and you can just like and you fit the sucker in your pocket. It's tiny. That one's So let's talk about some of the volumes, like the residual volume. So remember, that's the air remaining in the lungs after you've maximally expired, but it's keeping the shape of the alveoli. So that's like all that's really doing. There's a little bit of gas exchange, but it's not really like anything super significant, right? You're waiting for your tidal volumes for that. There's vital capacity, the VC. So that's the total amount of air that can be inhaled and then exhaled with like total maximum effort, right? So that's that one. So here's vital capacity, expiratory reserve volume, tidal volume. Inspiratory reserve volume is going to be equal to this like total max, like if you like on an average size, like healthy individual. Inspiratory capacity is different. So this is the maximum amount of air that can be inhaled after a normal tidal expiration, right? So here's tidal volume, that, plus your inspiratory reserve volume, so it's a little bit lower. Okay, so it's inspiratory versus vital capacity. So there's also functional residual capacity. So here's another, so these are all like flashcard stuff. And so what this is the amount of air that stays in the lungs after a normal tidal expiration, right? And so this is again like a reserve volume. Um, so here's your functional residual capacity is the reserve volume and your expiratory reserve volume all together. So it's just about 200 or 2,500 milliliters. And then the total lung capacity, the maximum amount of air that can go into the lungs, like no matter what, is respiratory volume and vital capacity. So that's a total in most individuals of about 6,000 milliliters. Spirometry is aiding in the diagnosis of especially restrictive and obstructive lung disorders, right? So restrictive disorders are going to be ones that don't allow the lungs to fully expand out, right? So there's scar tissue preventing that, right? And so that's what that means. So it limits the amount to which your lungs can be inflated, so it can't really move out beyond those points. And so what we're looking for is scar tissue, so fibrosis for the most part. So we're looking at things like black lung, tuberculosis, scarring from the infection, stuff like that is going to make it so there's so much scar tissue they just can't, they don't have that flexibility to really inflate well. So you got a smaller amount. Obstructive disorders are a little bit different. So this is going to be about the airway, right? So the airway, right, bronchioles and all this other stuff, like that pathway. So things that are going to really going to be characteristic of this are going to be, sometimes asthma, inflammation of these airways, or scarification, restricting their ability to, say, bronchodilate, for example. One is emphysema, so that is going to be combining elements of restricted, like so inflammatory scarring of the airway, as well as scarring on the lungs generally, right? So smoking is going to be that specifically. Oh, restrictive and obstructive. There it is. Okay. So continuing with spirometry, so forced expiratory volume, FEV, is the percent of the vital capacity that can be exhaled within about a second's worth of a time interval, right? Which is usually between 85 to 75%. Peak flow, right? Max speed of expiration. You're using the handheld meter. And so also minute respiratory volume, the amount of air inhaled per minute. And so this can also be repeated inhalations just over that minute. Okay. The maximum voluntary ventilation rate, MVV, uh, MRV during heavy exercise, right, is going to be one of them. And it can be as high as like 125 to 170 liters per minute. So that means like all of the cycles, right, that is going to be repeated, all the respiratory cycles that are going to be repeated. Your lungs are not going to get like that big. Um, right. Okay, variations in respiratory rhythm. We'll get into that next time. So I hope that was helpful, and I hope you all are out there having a wonderful day. Okay, bye bye.